Preschool Language Scales 5th edition, also known as the PLS-5, is a revision of the Preschool Language Scale 4th edition. PLS-5 is an individually administered test used to identify children who have a language delay or disorder. PLS-5 is developed for use with children from birth through 7 years 11 months of age. Administration time varies depending on the child's age, ability, and his or her perception during the test. The test could take anywhere from 25 to 60 minutes to administer. The PLS-5 can be used to help you determine if a child has primarily a receptive or expressive language delay or disorder. It can also determine eligibility for early intervention or speech-language services. It identifies receptive and expressive language skills in the areas of attention, gesture, play, vocal development, social communication, vocabulary, concepts, language structure, integrative language, and emergent literacy. All of this information can be found on page 3 in the examiner's manual. Materials. The PLS-5 is made up of the examiner's manual, the administration and scoring manual, the picture manual, the home communication questionnaire, the record form, and manipulatives. The examiner's manual provides information about test interpretation, test development, research, and technical properties of the test. The administration and scoring manual contains detailed information about test administration and scoring, as well as the normative score tables and other appendixes. The picture manual contains the visual stimuli necessary for administering many of the test items. There are 2 subtests, auditory comprehension and expressive communication. There is an optional 3rd test, the articulation screening, that is only used if the clinician notices errors in speech production. The home communication questionnaire includes questions that focus on how a child's receptive and expressive language skills, as related to the PLS-5 tasks, are demonstrated at home and on preschool or daycare settings. The questionnaire is completed by caregivers of children ages birth to 2 years 11 months. The record form contains abbreviated directions for the administrating, recording, and scoring test items. It also includes the articulation screener, language sample checklist, and the PLS-5 profile. Some PLS-5 items require the use of specific objects and toys. You may provide your own manipulatives or purchase the PLS-5 manipulatives. You will need a large number of materials, including a 6 to 12 inch tall teddy bear with movable arms and legs, a ball approximately the size of a tennis ball, 2 children's books with 1 to 4 lines of text on each page, an opaque box with a removable lid, and many more, as you can see here. If you are testing a very young child, you may ask their caregiver to bring a bottle with a nipple or a pacifier, 1 or 2 of the child's personal toys, and age-appropriate crackers or snacks. Scoring. There are 3 codes used for children ages birth through 3 years 11 months that are included on the record form. CR for caregiver report, O for observation, and E for elicitation. When testing very young children, caregivers can give information about the child to the clinician that can be used to pass the item. For example, on expressive communication item 9, seeks attention from others, the caregiver may report that the child seeks attention by pulling on her father's sleeve and lifting her arms to be picked up. Because this interaction meets the pass criteria for the item, the clinician would circle CR, write down the described behavior, and give the child credit for passing the item. Even if the behavior described by the parent does not meet the passing criteria, the clinician should still write it down because it might be useful for evaluating another language behavior. If you see the child exhibit a target behavior in a spontaneous interaction with someone, you can circle O for observation and give the child credit for it. If you are able to elicit a target behavior from the child using the elicitation procedures described in the administration directions, circle E for elicitation. You can use any 1, 2, or all 3 assessment methods on items and then decide if it meets the pass criterion that is shown next to each item on the record form. Each item has a maximum score of 1 and a minimum score of 0. Basal rules. A basal for both the auditory comprehension and expressive communication scales is achieved when a child has responded correctly to the first 3 consecutive numbered items from the start point for the child's age level. If a child does not achieve a basal for his or her age level, the clinician drops back to the start point for the preceding age level and tests forward from there. If the child still does not achieve a basal from the start point, continue to drop back to the preceding age level until the child achieves basal. If the child never achieves basal, item 1 is considered the basal. Let's meet our client. Kelly is a 4-year and 3-month-old girl. She was referred to the campus Speech-Language Hearing Center by her nursery school for a speech-language evaluation. Her teacher suspects Kelly has a mild language impairment. Kelly has difficulty answering questions in class, forming grammatically correct sentences, and identifying pictures. Her teachers worry that her expressive and receptive language skills are impaired. Kelly lives at home with her mother and father. She has one older brother. There is no evidence of genetic communication disorders in her family history. Kelly is monolingual, and English is her primary language spoken at home. Kelly is aware that a communication barrier causes her frustrations. Her parents often prompt her to elicit a verbal response. Her family asks Kelly, "Do you have any questions?" after speaking to her. Kelly does not receive special services or other therapies. Kelly is presently displaying signs of a language impairment. According to her teachers, she has difficulty producing spontaneous speech, correctly using pronouns, answering WH questions, and naming a variety of pictures. Her speech is intelligible 95% of the time, and she articulates sounds correctly. Her teachers are concerned that her grammatical errors affect her academic performance and social interactions. For example, she says, "him bag next to me" instead of "his bag is next to me." They worry that her reading and writing skills are negatively impacted by this miscomprehension. Kelly studies in a small classroom of 10 children. This increases the opportunities for Kelly to engage in conversations. The design of the school's curriculum promotes sensory awareness. It is helpful for Kelly to use her senses in pictures. Once Kelly touches and sees a dog, she is more likely to identify a picture of a dog correctly. Kelly's mother reports that she did not display signs of developmental delays at infancy. She did, however, achieve milestones out of sequence. For example, she learned to count before she learned to participate in fantasized play. As a toddler, she has not attained several language milestones. She struggles to carry on a conversation and to answer questions appropriately. Simultaneously, she has achieved other communication milestones, including her ability to use simple sentences and to understand gestures. She lacks in certain areas of language, but she compensates for them in other areas of communication. We will now begin with the auditory comprehension part of the test. It is important to note that the clinician may choose which subtest they wish to administer first. The auditory comprehension part will evaluate the scope of the child's comprehension of language. The items designed for preschool-age children are used to assess comprehension of basic vocabulary, concepts, morphology, and early syntax.
Look at these pictures and show me which one finishes my sentence. You sleep in a bed. You sit on a. Good. You eat with a fork. You cut with a. Good job. You hear with your ears. You see with your. Good. This is Miss Duck. And this is Mr. Bear. We're going to play with them. Mr. Bear is sleeping. Let's wake him up. Take the blanket off Mr. Bear. Good. Put Miss Duck in the box. Good. Put the box on the table. Now take the ball out of the box. Good. Give Mr. Bear one block. Give me some blocks. Good. Show me which picture answers my question. Anna hurt her knees and elbows. How do you think Anna got hurt? Good. Charlie played outside and got his shoes wet. How do you think Charlie's shoes got wet? Good. Sandra was very hungry when she came home after school. What do you think Sandra did when she got home? Good. Look at all these babies. Show me the baby who is not crying. Good. Look at all the chickens and the nests. Show me the nest with no eggs. Good. Look at all the toys. Show me a toy that is not in the basket. Good. Look at these crayons. Show me blue. Good. Show me purple. Good. Show me red. Good. Show me green. Good. Show me orange. Good. Show me yellow. Good.
We will now move on to the expressive communication part of the test. The expressive communication scale is used to determine how well a child communicates with others. Preschool-age children are asked to name common objects, use concepts that describe objects and express quantity, and use specific prepositions, grammatical markers, and sentence structures.
This girl is playing. Tell me about this girl. She is
Eating.
good. Now tell me about this girl. She is
Sleeping.
good. What are these?
Babies.
Good. What are these?
Horses.
Good. What are these?
Cats.
Good. Look at this boy. What is he doing?
He is washing the plate.
Good. He is not in the bathroom. Where is he?
He's there.
What room is he in?
In kitchen.
Good. Now I want you to answer some other questions. What did you eat for breakfast?
I went for a walk.
Good. Where did you eat breakfast?
Went to school.
Good. Where is the bear going?
Him Bear walking to school.
What is he doing there?
He going to eat.